Each of us has probably heard the advice that starting the day with a glass of water is one of the most beneficial habits. Doctors, nutritionists, and simply caring people tirelessly repeat this, and there is indeed a large grain of truth in it. Maintaining water balance plays a vital role in our health, especially over time. However, there is one nuance that is often forgotten when talking about morning water consumption. The way we do it can make a huge difference. Contrary to popular belief, drinking water immediately after waking up may not be so beneficial if certain factors are not considered. Yes, that's not a mistake. Ordinary tap water can create certain problems if you approach this issue without due attention, taking into account the changing needs of the body, especially at the age of 60, 70 years and older. Why is this happening? It's not that water itself suddenly becomes harmful. It's just that with age, our body often requires more careful treatment even of the simplest things. Think about it. Your gastrointestinal tract, kidneys, heart, all these systems have worked properly for decades. And now they may react differently than they did 20 or 30 years ago. After waking up, the human body experiences a period of increased sensitivity. Blood pressure shows instability, hormonal balance undergoes changes, and the digestive system is just starting its work. Frivolously drinking water at this delicate moment can turn into undesirable consequences that a person does not even suspect. Next, we will consider 5 common mistakes people make when consuming water in the morning. These are mistakes that are rarely discussed but have a significant impact on well-being throughout the day. Most people make them without realizing the potential harm. However, once a person becomes aware of these mistakes, they are easy to correct. By the end of this review, the reader will have a complete understanding of what to look for in order to start each day with a sense of calm, determination, and a surge of energy. The first and perhaps most important mistake is drinking ice water on an empty stomach. Imagine a typical situation. A person, barely awake and half asleep, goes to the refrigerator and pours himself a glass of ice water. He drinks it in one gulp, hoping that the sharp cold will help him wake up. Sometimes a person may feel a sudden surge of energy, as if some invisible mechanism has turned on inside his body. In other cases, not entirely pleasant sensations arise. Mild discomfort in the abdomen, nausea, or even a short-term headache, accompanied by dizziness. But why do such conditions arise? During sleep, the human body naturally regulates body temperature, slows down blood circulation, relaxes the digestive system, which leads to a slight decrease in temperature. With the onset of morning, the body gradually returns to an active state. However, the sudden introduction of a large amount of ice water can be a real shock to this smooth restructuring. It's like trying to accelerate a car to its maximum speed without giving the engine enough time to warm up. At a young age, such exposure may be relatively harmless or even have a stimulating effect. But over time, the circulatory system becomes more sensitive, and sudden temperature changes can cause even more constriction of blood vessels. Such constriction is not always favorable. It can provoke spasms, a feeling of cold in the extremities, and a general feeling of discomfort. Imagine a woman whose age has now reached 76 years, and for a significant part of her life, she had a habit of starting each morning with a glass of ice water. She invariably claimed that this ritual gave her a feeling of vigor and awakened her body. However, over time, she began to notice some unpleasant changes in her body. Digestion became slower, stomach cramps occurred more often, and her fingers and toes remained cold throughout the day. When she consulted her doctor, he recommended that she make adjustments to her morning habit and switch to drinking water at room temperature. She treated this advice with a fair amount of skepticism, thinking that it was the cold water that helped her wake up and cheer up. But after a week, she noticed positive changes. Her hands stopped freezing, her digestion normalized, and she felt calmer and more energetic in the mornings. It was a minor change in her daily routine, but it had a significant impact on her well-being. Therefore, if you're accustomed to heading straight to the fridge for a refreshing ice-cold drink as soon as you wake up, try making a small adjustment. Leave a glass of water on the counter overnight, or use lukewarm water from the tap. After just a few days, pay attention to how you feel and note whether you experience less tension in your abdomen and an overall improvement in well-being. You'll be pleasantly surprised by how much warmer and calmer your morning can become. The second common mistake many people make is drinking water too quickly or gulping it down in large quantities. Often, a person wakes up feeling very thirsty, with a dry mouth and signs of dehydration. In this state, they automatically grab a glass and empty it in an instant. Of course, this brings fleeting relief, as if quenching a tormenting thirst. However, such haste in consuming water can cause a brief but noticeable disruption in the body's function. It's important to remember that after waking up, the pulse gradually quickens and blood pressure stabilizes only after some time. The digestive system, which has been at rest throughout the night, may react negatively to the sudden influx of a large volume of fluid into the stomach, causing bloating, dizziness, and even mild nausea. Some people may experience dizziness or a fluttering sensation in the chest without attaching any importance to it, although the cause may be precisely the speed of water consumption. In addition, the kidneys have to urgently kick into gear to cope with the sudden increase in the amount of fluid. If the body is not yet fully awake and ready for such a load, this can lead to a slight electrolyte imbalance. The consequences of this imbalance can manifest as a mild headache, fatigue, or a general feeling of discomfort and desynchronization in the body. Let's imagine Walter, a retired and well-respected coach. For many years, his mornings began with the same ritual, waking up and immediately draining a huge glass of water that stood on his bedside table. Sometimes he felt great, but there were days when he was haunted by dizziness and slight weakness. Attributing this to age-related changes or stress, Walter continued in the same vein until his doctor advised him to change the habit. Instead of gulping down the water, Walter began to drink it in small sips, stretching the pleasure over 15 to 20 minutes. The result was not long in coming. He felt much better, and the morning ailments and nausea disappeared. The conclusion is obvious. It's necessary to give the body time to wake up before subjecting it to a water flood. It's recommended to sit down, take a few small sips, stop, take a breath, and then repeat. This should be seen as a gentle and careful awakening for the whole body, and not as a sudden alarm signal. Let's move on to another common mistake related to the choice of container for morning drinking. If there's a plastic bottle on the bedside table from which it's so convenient to take a sip immediately after waking up, then perhaps the person is drinking something more than just H2O. Many plastic bottles, especially those that have already been used or made from recycled raw materials of not the highest quality, may contain chemical compounds, in particular bisphenol A, BPA, and other potentially hazardous substances, which can penetrate the water. Even if the bottle is labeled as BPA-free, it may still contain alternative chemicals that, like endocrine disruptors, can mimic or modify the action of hormones in the body. For people experiencing age-related changes or taking medications that affect hormonal balance, blood sugar levels, or blood pressure, additional exposure to chemicals that disrupt this balance can be extremely undesirable. The problem is that negative changes in well-being can occur gradually and imperceptibly. The disease can develop slowly, manifesting as vague symptoms such as headaches, fatigue, minor digestive problems, or sudden mood swings. People often do not associate these symptoms with the use of plastic water bottles. Such a situation happened to a 70-year-old man who, in an effort to maintain the body's water balance, had a habit of filling an old plastic bottle with water before going to bed and drinking from it during the night and morning. Over time, the man began to suffer more and more often from debilitating headaches, a constant feeling of dizziness that haunted him until noon, and from mild discomfort in the stomach area, which appeared and disappeared. After a thorough conversation with an experienced nutritionist, it became clear that the cause of the ailment could have been a simple plastic bottle, which he habitually left at room temperature for extended periods. Realizing the potential danger, he immediately switched to using a glass bottle, which he filled with fresh, crystal-clear water every morning. And lo and behold, after just a few weeks, the headaches and morning sluggishness began to gradually recede. Waking up, he felt full of strength and energy, as if reborn. Thus, it is worth considering if you are still using an old plastic bottle, or even a new one, but are not sure of its quality. Perhaps you should consider switching to safer materials, such as glass or stainless steel. This is a small but extremely important change, especially considering that in the morning the human body is particularly susceptible to external influences. Give your body a chance to rest from potentially harmful chemicals, and this will certainly only be beneficial. Another common mistake to avoid is drinking water immediately after taking certain medications, especially when the stomach is either overfull or completely empty. Taking medication in the morning is a common practice for many people. Often it becomes a daily ritual when you need to take at least one pill to maintain thyroid health, control blood pressure, or solve other problems. Medical professionals usually limit themselves to a general recommendation: take with water. However, they often do not specify how much liquid is needed, after what period of time you can eat, or whether prior stomach filling is required. Such nuances can have a significant impact on the effectiveness of the drug and the patient's overall well-being after taking it. Consider a typical situation. After taking the medicine, a person immediately drinks a large glass of water on an empty stomach. As a result, unpleasant sensations such as nausea or heartburn may occur. In some cases, this may even affect the rate of drug absorption into the bloodstream. At the same time, taking morning pills after a heavy meal and washing them down with a large amount of water can also lead to decreased absorption, especially if the drug is intended to be taken on an empty stomach. Thus, it is necessary to maintain a delicate balance, considering that some elderly people may have a particularly sensitive digestive system. People often tend to underestimate the sensitivity of the intestines, but it is the precise combination of medications, the amount of liquid consumed, and the correct time interval between taking the medicine and eating that determines the productivity of the morning and the overall well-being throughout the day. Otherwise, a person may experience headaches, nausea, and general malaise. A telling case is that of an 80-year-old woman who had been experiencing discomfort for several months. She had been taking medication for thyroid disease for many years without experiencing any side effects. However, suddenly, after taking the pill, she began to feel nauseous. At the same time, the dosage of the medication remained unchanged, and the results of blood tests were within normal limits. In a conversation with the doctor, it turned out that the patient had begun to follow a common internet tip: to wash down the pill with a large amount of water, believing that this would speed up its absorption. Ironically, it was this sudden flood that caused the problem. It turned out that such a volume of liquid, drunk immediately after taking the medicine, was excessive for her stomach, which caused a negative reaction. After adjusting the medication regimen, namely reducing the amount of water taken with it, and maintaining a 45-minute pause before consuming additional liquid and breakfast, the nausea stopped. The woman was amazed at how a slight change in habits could improve her well-being in the morning and give her more energy throughout the day. Thus, if unexplained side effects occur, such as tremors, nausea, or headaches in the morning, you should not immediately attribute them to age-related changes or the action of the drug itself. It is possible that the reason lies in the incorrect medication regimen or other factors related to the functioning of the gastrointestinal tract. It is worth paying close attention to how exactly the process of washing down pills with water takes place. In some cases, only a small sip of life-giving moisture is enough for successful medication, after which you can take your time to drain a whole glass. If you have doubts about the optimal time and amount of water, it is strongly recommended to consult a doctor or a qualified pharmacist. Even minor adjustments to water consumption while taking pills can noticeably ease morning routines. It's also a mistake to completely skip breakfast in favor of water. In modern society, there's a growing trend of completely skipping the morning meal and replacing it solely with water or a cup of coffee until lunch. For certain categories of people, particularly young individuals or those who adhere to certain types of intermittent fasting, this approach may be perfectly justifiable. However, for many older adults taking medications or experiencing issues with blood pressure and sensitivity to blood sugar levels, such a practice can have unpredictable consequences. It's essential to consider what happens to the body overnight. A person has already refrained from food for approximately 7 to 9 hours of sleep. This is a rather long period of fasting. By morning, energy reserves begin to deplete, blood glucose levels may drop, and the body urgently needs nutritional support, especially the brain and muscle tissue. Water, of course, helps restore fluid balance, but it cannot replenish the vital nutrients and calories necessary for normal bodily function. By extending the period of overnight food abstinence until noon or even later, a person risks experiencing unpleasant sensations such as tremors, increased irritability, fatigue, and even confusion during the first half of the day. Often, such symptoms are mistakenly attributed to stress or lack of sleep, while the true cause lies in a simple lack of fuel for the body. Even a modest breakfast, consisting, for example, of a small fruit, a serving of yogurt, or a piece of whole wheat toast, can have a significant impact on stabilizing emotional state and maintaining concentration. As an illustration, consider the story of a 69-year-old woman who decided to skip breakfast in an effort to lose weight. Before lunchtime, she replaced meals with a couple of glasses of water, sometimes allowing herself a cup of coffee. Initially, she felt a surge of energy and even noticed a loss of a few pounds, but soon, sudden mood swings and memory lapses began to appear. Considering that forgetfulness and concentration problems are common symptoms in older age, her daughter insisted on a visit to the doctor. During a conversation with the doctor, it was revealed that the patient was not eating until noon. The doctor immediately recommended including at least a small morning meal in her diet, suggesting options such as an egg, a serving of oatmeal, or a piece of whole grain bread. Within a few days, the woman felt significant improvements, clarity of thinking, improved concentration, and reduced irritability. It became clear that the person's body was in dire need of protein, fiber, and vitamins at the start of the day. It wasn't about overeating. She consumed just enough food to maintain a stable blood glucose level and provide herself with energy. Therefore, if a person is accustomed to skipping breakfast and only quenching hunger with water, one shouldn't automatically assume that less is better. Hydration is certainly important, but for optimal bodily function, nutrients are also necessary, especially with age. If a person usually limits themselves to just water, it's worth trying to add a small portion of something nutritious to it. The result may be surprising, an improvement in well-being both physically and psychologically. Summarizing the above, we can highlight 5 of the most common mistakes people make when following the widespread advice. Drink water first thing in the morning. Let's recap. Drinking ice water, especially when the body is just waking up, can be quite a shock. It can cause cramps, a feeling of coldness in the extremities, or slowed digestion. Switching to room temperature or slightly warm water can bring relief. Rapidly gulping down life-giving moisture when a person drains a significant volume of liquid in one go can become an unbearable burden for the body, only just waking up from a night's sleep. This can lead to dizziness, nausea, and even a disruption of the fragile electrolyte balance. It's much wiser to quench thirst slowly, savoring each sip. Don't forget about the hidden dangers associated with using plastic containers that have been left out all night. Cheap or long-used plastic can release harmful chemical compounds into the water, negatively affecting hormonal balance. As an alternative, consider options made of glass or stainless steel to preserve the pristine purity of the morning water. Caution should also be exercised when taking medications and water simultaneously. Taking medication on an empty stomach or drinking too much liquid immediately after can negatively impact absorption and overall well-being. If you're unsure about the correct timing for your medication, consult a doctor or pharmacist. Also, avoid replacing a proper breakfast with just water. While fasting can be effective for some, if you experience shakiness, fatigue, or confusion afterward, your body needs a small, nutritious boost to balance blood sugar and provide essential fuel for activity. Some nuances may seem trivial at first glance, but they can significantly affect how you feel throughout the day. This is especially true when your body is more susceptible to external factors, whether due to medication, chronic conditions, or natural aging. Morning rituals set the tone for the entire day. If your morning starts rushed, shocked, or uncomfortable, it will inevitably affect all areas of your life. Conversely, a calm and mindful start to the day lays a solid foundation for both physical and emotional well-being. Water is crucial for maintaining health, but how we consume it matters. Drinking very cold water all at once, or water that has been sitting in a plastic bottle overnight, can negatively affect your well-being. Also, consider the combination of water with food and medication. Drinking a large glass of water after a heavy meal can interfere with the absorption of a drug that should be taken on an empty stomach, and vice versa. Such adjustments may seem minor, but they can dramatically change how refreshed and energized you feel, allowing you to feel full of strength and energy throughout the day. When your body persistently signals problems, whether morning migraines, nausea, or unexplained spasms, it's a good reason to analyze your daily routine. Often, the simplest adjustments are the most effective. Therefore, starting tomorrow, take extra care of yourself. As a first step, place a glass of clean water by your bedside, preferring glass or stainless steel to plastic. If you prefer warm or room temperature water, that's excellent, as the body often responds favorably to this gentle temperature. If you are taking medication, consult your doctor about the best way to take it with water. Also, if you regularly skip breakfast, try adding a light but nutritious snack to your morning routine, such as a fruit or a small amount of protein. The key is to listen carefully to your body's needs. Positive changes indicate that your measures are effective. Otherwise, continue experimenting. Remember, everyone is unique, and there is no one-size-fits-all morning routine. The main thing is to approach the process mindfully, gently, and without rushing. Take care of your body's hydration, and see you in the next